Serina, we hear a lot about bioidentical hormones versus compound hormones. And can you clarify with us how this is comparing apples and oranges and not a valid comparison at all?
Okay. Well, bioidentical hormones and compounded hormones can overlap. Bioidentical means that those hormones are structurally exactly like the hormones that your body makes. And compounded means that these formulations are made personalized and customized for you in the lab of a compounding pharmacy. They there are fewer options that are commercially available. And so for bioidentical hormones that are commonly used, like estradiol, there's lots of options for commercially manufactured estradiol. But when it comes to progesterone, for instance, there's not a lot of options. There's one available, and that's micronized progesterone oral capsules. And so if you needed something different, for instance, a topical progesterone or a vaginal progesterone, that might have to be compounded. In situations where you might have sensitivities to ingredients, inactive ingredients, that might have to be compounded. And in some types of bioidentical hormones, for instance, testosterone, if you're using it for a woman, DHEA, that's also another bioidentical hormone. Estriol, those aren't available in commercially available forms. And so it has to be compounded.
Okay. That's helpful. So really what we're talking about is commercially manufactured versus compound, where commercially manufactured is what we traditionally know from the commercial pharmacies and the pharmaceutical companies, and it's standard
Yeah,
um, hormones with standard doses and
exactly.
fats. Is that right?
That's exactly it. Whereas with compounded, it could be made exactly, that range can be a lot bigger and it could be customized for your exact needs. But sometimes it's not necessary, sometimes the standard ones are perfectly fine. It's just nice to have both options.
Right. And so that's very helpful because I think they're out there in the discourse and the ethos, you hear bioidentical versus compounded, but really bioidentical is just hormones that are made that are identical to how your body would handle those hormones
Exactly. Yeah. And
versus
so
synthetic.
synthetic, exactly. Synthetic would be man-made or created, or it could be it might not be synthetic, could still be considered natural, but if it's animal derived and it's structurally different from what you would make as a human, it's not bioidentical, but it could be considered natural. And an example of that would be estrogen that's derived from the mare's urine, and that's conjugated estrogen. It's considered natural because it comes from the horse, but it's not natural to you as a human. And so it's made for the horse. It's a lot more potent than what we would be used to. And so the side effect profile would be very different.
Gotcha. And in today's world, do we actually use the synthetic hormone option still, or is it all bioidentical anyways?
It's case by case basis. The conjugated estrogen, like Premarin, it's fallen out of favor, that's for sure. There might be a rare practitioner that's still prescribing it, but it's very rare now. But synthetic hormones still have a place in therapy. For instance, with birth control, estradiol, that's synthetic, but it makes a lot of sense in that situation. You want that estrogen to stay in your body for 24 hours so that you don't have that chance of getting pregnant. Whereas if you took a bioidentical, it'd be gone in a couple of hours, and it'd be hard for, a lot of women to just be compliant on using it multiple times a day to prevent pregnancy. And so it makes a lot of sense in that situation. It just depends on the person and what's going on.
So, as it relates to systemic hormone therapy, most of it is bioidentical today, for the most part, except for unique circumstances. Is that
Yeah,
right?
for the most part, it's switched over for sure.
And so, this whole almost dialogue around bioidentical versus synthetic in the context of systemic hormone therapy is not really a big controversy anymore. Meaning, like if women were afraid of what they might get, they really don't need to worry that much, or they could just check and ask that it is bioidentical.
Right, right. And also the dosage form and how it's taken makes a difference as well. Bioidentical estrogen applied topically is still considered safer than taken orally, even if it's bioidentical. So there's a lot of little nuances. But most practitioners are switching over for, to bioidentical hormones when it comes to HRT.
And so bioidentical estrogen, bioidentical progesterone, and the estrogen could be a patch, a topical cream, or a pill. But all are safe. They just err less on the pill because it passes the liver. Is that right?
Exactly, passes through the liver, so there's a bit of an increased cardiovascular risk. Mhm.
Gotcha. Gotcha. Um, and so for like what would be to like what are some of the situations where compounding really is a much better option than commercially manufactured?
Yeah, I'd look at, say, if I break it down by the hormones,
Mhm.
if you're in need of estrogen, but let's say you have a high family history or personal history of an estrogen dependent cancer, like breast cancer, then you might want to use estriol as your estrogen of choice, and that's which is safer than estradiol, and that has to be compounded. If you are reacting to any of the commercially available forms, you might want it compounded so it has more hypoallergenic type of ingredients. If you need progesterone, but the commercially available dose of 100 milligram isn't perfect for you, if you're getting some side effects because it's a bit too high or you're not getting quite enough of an effect, you might want that compounded to a different strength. Alternatively, if you have issues with staying asleep, progesterone is really helpful for staying asleep, but the commercially available form is not a longer acting capsule. And so it'll wear out, and you might want it compounded into a longer acting form. Vaginal progesterone has been compounded for a very long time. It's often used for fertility, and it's now available as endometrium, but it's if it's back ordered or it's not available where you live, then that has to be compounded. Third thing is testosterone. Oftentimes, women will need a bit of a testosterone supplementation, but the commercially available testosterones are made for men, and so that concentration is just a lot higher. And so it ends up causing side effects like a bit of facial hair growth or hair loss from the head. And so you'd want that compounded in a smaller concentration that's appropriate for women. And then in the last commonly bioidentical hormone that we compound is DHEA. It's now available commercially as a vaginal insert to help with things like vaginal atrophy, but some women might take that orally as a capsule to help them indirectly with some of the other hormones like testosterone, and that's compounded.
Okay, that's great. Well, if we just go back to some of the fears around compounded and some of the things that I see headlines about and people talking about that compounded pharmacies, that you can't be sure of the quality or the prescriptions would be non-FDA approved, or like, can you just talk to some of those things that we hear out there about compounded pharmacies?
Yeah, so choosing compounding pharmacy is a lot like choosing a different practitioner like a doctor. They vary in how they do things, but overall and in overarching regulations, we now in North America follow what are called NAPRA guidelines, which regulate how we practice in compounding pharmacies. It makes it quite stringent in how we compound, the hygiene, the level of accuracy, and also the technology has improved. And so there are a lot of safe measures to ensure that compounds are safe to get. Um, I know there are sometimes headlines about things happening that the worst case scenario. And so things like that that's happened in the last decade where, some error happened in a compounding pharmacy that led to more stringent regulations. And so when we get inspected, the checklists and the guidelines are quite they have a high bar.
And so help me. So as putting on like the hat of just a woman who's entering perimenopause or menopause and is so confused and is afraid that hormone therapy is going to cause breast cancer. And um, what are some advice that you would give to help guide that woman to getting access to understanding of hormone therapy and hormone therapy?
Well, first of all, I recommend them seeing a practitioner who is knowledgeable in this expertise and in this area, and they would assess that patient or that woman individually to see what her risks are. Um, if she's had any family history or personal history, this will guide their decision on what type of hormone therapy she's able to get, what would be safest for her. And so there are different options of risk. The traditional estrogen that most women get would be estradiol, and that's the most potent form. It helps really well with a lot of the menopausal or perimenopausal symptoms, but that may or may not be appropriate for everyone depending on your breast cancer history risk. If you're just a regular, if you don't have a lot of risk in your family history or in your personal history, then it's pretty safe. It as long as you don't apply the topical estrogen onto your breast directly, it's actually not much of an increased risk. Now, there's a lot of studies that have recently come out to look at these numbers and see and show that benefit when it's applied topically.
Mhm. So here's a question I have for you.
Yeah.
Um, Birth control pills. So
Yeah.
birth control pills are synthetic hormones. True or
Off,
false?
yes, synthetic. I'm thinking in my head, I'm running through all the different types and they're all synthetic.
Okay. And I read that birth control pill type of synthetic estrogen used impacts testosterone levels in a female. Is that correct?
It has androgenic type of effects. So I don't know if it has a huge effect on your testosterone levels. A lot of the progesterones in most of these birth control pills are a bit androgenic. So the side effects of them act a bit like testosterones. But sometimes a lot of the time with hormones, there's a feedback mechanism. And so when you're elevating these levels, it will affect the feedback and production of the other hormones.